November 14 is celebrated as World Diabetes Day worldwide. Let us take this opportunity to know more about diabetic eye disease. Well, diabetes is known to affect the eye by increasing the progression of cataract, affecting vision by causing diabetic retinopathy, and also increases the risk of glaucoma. Of these, the most common cause of permanent vision loss is diabetic retinopathy. Inside the human eye is a layer of light-sensitive tissue called retina. Diabetes causes retinopathy by damaging the blood vessels of the eye, leading to damage of the tissue. Damaging blood vessels cause them to be leaky, leading to macular edema. What are the types of diabetic retinopathy? As diabetic retinopathy progresses over time, non-proliferative diabetic retinopathy can range from mild to moderate to severe retinopathy. When new fragile blood vessels are formed due to long-standing disease, it is called proliferative diabetic retinopathy. This picture shows non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. As you can see, new blood vessels which are fragile in PDR, leading to hemorrhages over the retina and also traction or pull over the retina. So how do we know whether we have diabetic retinopathy? In the early phases of diabetic retinopathy, there can be no symptoms, so the disease can slowly advance without warning. Commonly observed symptoms seen in patients are decrease in vision, spots noticed in the vision, shade noticed in the field of vision, or even eye pain. What is the reason for the development of diabetic retinopathy? Diabetes results in high blood sugars to be stagnated inside the blood vessels of our body, which can in turn damage the blood vessels themselves, leading to leakage from these damaged blood vessels and eventually leading to blockage of their lumen. Damaged blood vessels leaking fluid can cause accumulation at an area called macula, which can affect the vision. Blockage of blood vessels can lead to new fragile blood vessels being formed, which can lead to vitreous hemorrhage or traction over the retina, which are some of the complications affecting vision. Who is at risk for diabetic retinopathy? Among patients who have diabetes, those who have had longer disease duration, diabetic patients who had poor blood sugar control, diabetic patients with high blood pressure, diabetic patients with high blood cholesterol levels, those who also smoke, and diabetic patients who are pregnant are at increased risk of developing retinopathy. Let us also look at the diagnostic tests for diabetic retinopathy. Examination of the eye by an expert, which includes vision evaluation, dilated evaluation of retina, which includes retinal examination by eye specialist using special instruments. Let us also try to understand more details about dilated eye examination. A dilating drop is first instilled in your eye, which takes around 30 to 60 minutes to dilate the pupil, which helps in better visualization of the retina as it gives larger view of the retina, and every corner of the retina can be checked for damage. The other tests used are fundus fluorescein angiography and OCT scanning. FFA is a specialized examination technique for evaluating the stage of diabetic retinopathy and other important information using a special dye called fluorescein. OCT scanning is a scan of the retina which gives detailed structural assessment of the central part of the retina. In diabetic retinopathy, it helps the doctor gather more information regarding macular edema, damage due to decreased blood supply, or even pull over the retina causing detachments. How is diabetic macular edema treated? When diabetic macular edema does not involve the center of macula, the doctor may choose to treat it with laser therapy. Most commonly used treatment modality for edema or thickening that involves the center of macula and affecting the vision is it with intravitreal injection. The medicine is injected to the white part of the eye so that the medicine reaches the center of the eye. How is proliferative diabetic retinopathy treated? The proliferative stage of the disease is treated with multiple laser sittings, which helps in bringing down the growth of unwanted new blood vessels in the retina. When is surgery done for diabetic retinopathy? There are situations in the disease progression which calls for surgical intervention. When there is significant quantity of vitreous hemorrhage that obscures vision, or the retina develops detachment due to pull from blood vessels resulting in vision loss, such changes in the eye requires surgery. When should I get a diabetic eye exam? Every person with type 2 diabetes should get their eyes checked at the time of diagnosis and yearly thereafter. Once diabetic retinopathy is diagnosed, then the eye specialist decides on the follow-up timings for the patient according to their disease stage and complications. Every person with diabetes needs to know that vision loss from diabetic retinopathy is largely preventable if treated timely. Managing blood glucose levels along with the good control of other disease which damages blood vessels, that is hypertension or high cholesterol blood levels or even smoking, are very important in preventing the onset of diabetic retinopathy as well as its progression. Of utmost significance is the regular checkup that help the patient to be aware of diabetic retinopathy status and appropriate treatment as and when needed to prevent vision loss and possible blindness from a disease which is largely preventable.